Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
All right, guys. So I welcome one and all once again for my class, and let's begin with labor care guide versus partogram, in which I'll be telling you the differences between why we shifted from the old partogram to the labor care guide. Okay, we have also worked on the partogram. I didn't find a lot of difference, but it's true. It's true actually why labor care guide works better, makes you understand and sees a broader perspective, and makes you take decisions more guarded. Okay, it's a little more flexible, involving more confounding factors, and believe me, all those factors really work. Now, let's start with our old partogram. It was so difficult to even fetch a proper looking image from the net. Initially, I was thinking I'll just take the class with these two slides, okay, and be done away with. But my students, very whiny. They want me to write down every difference, so that when it comes to the exam, they learn my tablet, the tables, and they're done with it. Okay, they don't have to listen to my class. So have a look at this partogram, the old partogram. What do you see in this? Of course, initially in the beginning, you write down about the patient's details, right? And then you tabulate the fetal heart. You are tabulating the fetal heart. So the moment it goes down, the moment it goes up, here there is no alert line. Okay, they're expecting that this particular thing, you take care yourself. So when you're talking about a partogram, it is individualizing the corners. Only thing they're bothered about is this part, where they feel that there is a need of alert and action line. That means how the cervical dilatation is moving is the only important factor according to the partogram, right? They're not really bothered about meconium stained liquor, because that's not coming in any of the action lines anywhere. They're not really bothered about the fetal heart going down, because again, where's the action column? Where is the alert column? Here. Okay. According to them, mother is nowhere in the picture, only because there's no maternal pulse. How is the mother doing? What is her blood pressure? Only one column we see towards somewhere over here, where we see the urinary proteins and ketones, where I think that is the most important thing according to them. And yes, one temperature is also there. Okay, here they have mentioned pulse and blood pressure. Again, over here, guys, they've not mentioned about the action and alert, whether this is okay, whether mother is fine or it's not fine. So there is no such thing, just a mini teeny over here. They've talked about maybe how's the pulse doing, how's the blood pressure doing. Again, they've not made any action line, any alert line. And it's towards the end, fag end, that, how's the mother doing maybe. Okay, by a small teeny mini this thing, in which they've just told, okay, just see if your urine ketones are present or not, if the blood pressure is fine, if the pulse is fine. But where is the action line? Where is the alert line? Where should we have this feeling that, yeah, mother is also an important entity while we are deciding for the baby? And then, of course, they've spoken about drugs, IV fluids, that you will find even in the labor care guide. All these columns you'll find in the labor care guide, but you will not find where we have to stop, where we have to think, where we have to, involve our seniors, at what point of maternal, let's say, tachycardia along with ketones do we have to inform? We're just plotting it. This is basically there. See, this is all coming mostly from the, the Western countries, and there you have midwives mostly taking care of the deliveries. So midwives are very highly trained. Their level of SRs, okay, even more than that, I would say, because experience is far more. So those people, they were given partogram before, so that they knew when they have to speak to the consultant or a senior at the level of alert or action. Okay, but they were not told at what level here in the maternal pulse, blood pressure, ketones, and glucose or temperature going high. They have to inform. What about the fetal heart? CTG they'll inform definitely, but not anywhere over here. Then at the same time, then you come down to the next column. This was cervical dilatation, descent of the head. Okay, this is, I see it's marked. Coming down to the uterine contractions. See, uterine contractions is saying how hard the uterine contractions are, isn't it? Whether they are weak, whether they are moderate, whether they're strong. But suppose you're having 6 uterine contractions in 10 minutes. Do you think it's normal? What is tachysystole, guys? Can you please quickly write down for me? What is tachysystole? Who's going to give me an answer? Attempt, guys, attempt. Come on. What do you mean by tachysystole? How will I know whether this patient is having just the right number of contractions or not? When you have more than 5, Yes, when you have more than 5 uterine contractions in 10 minutes is tachysystole. Okay, till 4 is fine. 5 or more than 5 is not good. So if I'm having more than 5 uterine contractions, all are weak, or let's say all are moderate. Is it normal? No, you have to inform. It's an action line. No, it's not written over here. So these are the problems of the old partogram. Now let's jump on the labor care guide and talk about it in detail, what labor care guide actually is. So the first column, now please be patient with me. I'll go slow and I'll go one by one to make you understand what is the significance. See, the first column is the one in which you will talk about the patient. Okay, you will write down everything. She's what gravida, what para, when was she admitted, with what problems was she admitted, when did she go into active labor, and when did she come over here, labor onset what time, active labor what time, rupture of membranes at what time, what are the high risk factors. So anybody who takes over this patient is, knowing it right from the very beginning, what I'm dealing with. Everything is there. The IP number, name, and everything is fine. But what is her parity? What is her, how gravida is she? What are the weeks of gestation? When did her labor start? When did she go in active labor? And whether she ruptured her membranes, everything. When did she rupture the membranes? Everything is written down. And of course, a few of her tests, whether she's HIV positive, HBV positive, and all that. And now have a look at this column I'd like to mark. Alert column. All the things below, everything can be an alert. Okay. There could be a maternal pulse which can cause you to be alert. There is a maternal blood pressure that can cause you to be alert. There's a maternal, urinary ketones that can cause you to be alert. There's a possibility at every step of the way. And there are more columns as well. You're not restricting yourself to only cervical dilatation or maternal temperature, or let's say uterine contractions are mild, moderate, and weak. No. We are going farther than that, and let's see what all columns now they come. And have you seen this column? The second stage column is well over here. That here she's an active first stage, here she's got an active second stage, and second stage, where is the second stage column here? Can you please tell me this? Once she has dilated 10 centimeters, are we talking about the second stage or not? So there can be no problem in second stage, is it? So don't you think this labor is continuing in the second stage? Second is the most important stage in the labor. So partogram will finish off at first stage. Another very important aspect. So labor care guide, the one over here, takes into account the second stage. Okay, let's start. So the first thing I wanted to bring your attention to was the alert column over here. An alert column comprises every small column. Alert column is standing for everything. Over here, alert column was only for an alert and action column was only for cervical dilatation. That means if the cervical dilatation is moving fine, patient is doing okay. What about fetal heart? What about meconium? What about descent of the head? Most important. Okay. So the first column is about the supportive care. Now, they did a study, okay? They did a study, and according to them, they found that if you have a companion, okay, and you must have also seen this, usually the VIP syndrome, the people who are VIPs, everybody who's working, many of my students are in corporate hospitals, and you see the culture there. So patients who are socioeconomically weaker sections, and they have those, relatives who are like a little strict with them, and they're like, it pains that much. Okay, you have to be tolerant. You have to be bold. You see that they not only progress faster, they also deliver without any complications, without any interventions. And all those, affluent family people who take the labor suite, and they have those, husbands or their mother-in-laws or their mothers who are like, doctor, she's having a lot of pain. Doctor, we are rubbing the back. Doctor, can you please see her every 5 minutes? With every contraction, to be more correct, they usually end up in having either a cesarean section or an interventional instrumental delivery or a second stage arrest, some or the other complication. I mean, if you do a real study on them, I think 8 out of 10 will have all problems and only 2 might deliver. Okay, so companionship, very important. So if there are no companions, and I think they should add one more, that they have very high profile companions who are not helping them, they're not going to have a very smooth progress of labor. That's one thing. Second is pain relief. if they've not usually opted for pain relief, they will give up faster. They will get exhausted when the time to push will come, which is an equally important time. So, no, they cannot, if they're not taking a pain relief, that's an alert line. You've got to be alert with this patient, right? Then oral fluids. If they're not taking oral fluids, if not taking anything, they get dehydrated, exhausted, finally not able to progress in the second stage of labor, not able to push, and then finally, because of maternal exhaustion, either going in for an instrumental delivery or going in for a cesarean section. Correct? And what about the posture? If they're in supine posture, they're lying down all the time throughout their labor, usually they will not progress well. So the gravity does its own job, and they're not working through. Just lying down again and again. So the baby is not coming down properly, or the baby is twisted, turning, and the head is rotated and not coming through properly.